back to my channel. Welcome back to my vlog. What's poppin'? What's poppin'? What's poppington? Everybody knows I get my intro from Breland Hunt. She goes by Breland Hunt. Now I just finished watching her A Work in Progress podcast right now. So good. If you're not watching that, you should definitely go check that out. Someone else I'm heavily influenced by is Hannah Olivia. If you're not watching her, go check her out. But let's talk about why we are here today. As you can tell by the video name, we are talking about how to get started in healthcare administration. And you're going to see me look down at my notes because y'all, sis, came prepared. I'm about to give you the factimonials, okay? We're going to get you started in your healthcare administration field. So first, let's talk about what it takes to get in there. The first question I got actually came from TikTok. If you're not following me on TikTok, go check me out at Coach Mimi 12. Her question was, what previous experience directly correlates with healthcare management? So when we think about healthcare, getting into the healthcare administration fields, there are two sides of it. The first side is healthcare administration, and the second side is healthcare management. So let's break those two things down a little bit. Healthcare administration is the day-to-day task. This is like checking people in and out. This is like recovering billing, opening the doors, closing the doors, anything that you would do in an organization on a day-to-day basis. Healthcare management is more business office related. It's more about the fiscal and financial issues or gains of the organization, and quality improvement and quality assurance is a big part of healthcare management. So let's talk about some jobs that you guys could possibly already have that will correlate smoothly into the healthcare administration field. So if you want to get into healthcare administration, this is like the day-to-day thing. Some jobs that would work well with this would be if you were a receptionist for a hotel, a salon, a spa, anywhere where you were directing patients or clients face-to-face, any type of reception work. If you ever worked in a call center, I'm so huge on this. If you worked in a call center, you are ready for healthcare administration, period. We're a call center for Verizon, for AT&T, for the cable company, any type of call center, the electric company. If you worked that, you are ready for healthcare administration. They are literally the same thing. Also, if you worked in retail, you would be great for healthcare administration. If you are wanting to get in healthcare management, there are a little bit more qualifications that you need to have, but they're not all healthcare related specific. So if you were a store manager for like an American Eagle or any type of retail store, you would fit well there. If you were a restaurant manager, front of the house or back of the house, it would be great. Or if you ever worked a home-owned childcare service, whether it was your home, in your home, that's like really good. Or if you worked in a childcare service for anybody else's organization, if you were ever in any type of leadership role, you're ready for healthcare management. So I do definitely want to say that the jobs that I named off are not the only specific jobs that you could have ever had to get in healthcare administration. There are tons of transferable skills out there. So really you should take a look at your resume, take a look at your comprehensive work history, and determine where you've been the longest, what you have the most experience in, and how you can translate those specific skills into getting into the healthcare field. So let's talk about transferable skills now. So in the healthcare administration field, whether you're going into management or administration, I'm going to give you the top, let me count, 1, 2, 3, 4, 5, the top 5 skills that I feel are needed in the healthcare administration field. I'm going to tell you why they're important and how you can relate it to whatever you've done in your previous work or your current work, and how it can relate into the job that you're trying to get into now. So the first skill we're going to talk about is customer billing and follow-up. Sometimes in the world that we live in today, people really just can't afford their health care. There could be any reason why. Maybe their deductible is too high. Maybe they don't even have insurance. Maybe they ended up in a hospital in an emergency and they weren't prepared to have any medical services done. Nevertheless, pay for them. So when the situation comes about, you have to be very tactful and very mindful of the patient and their situation, but also keeping in mind that your organization provided a service and, you know, would like to be paid for said service. So if you've ever worked anywhere where you have created a payment plan with people, specifically in call centers, Sometimes y'all be a little drastic with it. No, just kidding. But if you've ever created a payment plan with someone, you're ready. You have customer billing and follow-up. If you have ever called someone about missing a payment and figured out how you could get that payment taken care of, you're ready for the skill. You have the skill. If you have ever even did sales where you took money in hand or ran somebody's credit card or printed them off a receipt or issued a refund, if you've done anything with money in your position, you have a transferable skill. You are able to collect billing information and do follow-up work behind that settlement. The next skill we're going to talk about is quality assurance and control. It's important in the healthcare administration, in the healthcare field, period, administration or clinical, that organizations are following JCO and their state and federal guidelines, period. Like, in the healthcare field, you are held to a certain standard. Not anyone can just go out providing healthcare. You have to be certified, you have to be licensed, you have to be told by your government in your state that it is okay to do so. So if you have worked in a job where you have to follow any type of regulation, you have the skill. And really, in America, everything has a regulation. So almost every single job, I can almost assume that you've done something like this before. Whether you work in a kitchen, you guys have to follow certain standards and guidelines. Food can't be left out overnight. Things have to be cleaned up every day. If you do that every day, you're following those guidelines every single day. If you work in a retail store and you've ever had managers fly in from different states and they come and inspect your store, all of the work that you do prior to them coming to inspect your store is you keeping up with quality assurance and improvement. Next skill I want to talk about is staff or project management. In the healthcare field, anyone who's in any type of management position will be overseeing physicians, any other administration people like myself, owners, stakeholders. You will have an eye over anything that has to do with the managerial experience of that organization. So if you have ever been a manager in any previous role, you have some transferable skills that will get you into management in the healthcare field. If you've ever had to deal with any type of conflict resolution between your employees, if you've ever had to create any financial reports to report to somebody, if you've ever had to create schedules and follow up if those schedules aren't working well, if you've ever had to work with different people in your organization to get a common goal done, those are transferable skills for healthcare management that you are ready for. It doesn't matter if you've been a manager at a grocery store or at a gas station or at a call center. Management skills are management skills. It's all about the way that you present yourself on your resume. Another skill I want to talk about is relationship building. In the healthcare organization, we are attached to so many other organizations. It is imperative to be able to build quality relationships with anyone that your healthcare organization works with. For example, I held a position in revenue and I was always on the phone with insurance companies. And you can bet your bottom dollar that I had one representative from each insurance company that I built a relationship and that I could call their personal line to get any documents that you need. And I got that through my charm. No, I'm just kidding. I got that from being a nice person and being able to build relationships. It is their job, regardless, when you call an insurance company, it's their job to help you. Like, that's what they are paid for. But they don't always make it easier. Sometimes you get people who are very new in the field or new in that position and they don't always know what's going on. It is great to have someone who you know you can call that's going to get you the documentation that you need. That's built on relationships. And not only will you need relationships like that, but sometimes your business will want to merge and work with other businesses. For example, I held a position at a surgery center, and this specific surgery center had doctors from all types of practices get rights to use their surgery center, and the surgery center got a profit for it, and so did the doctor. So we were always holding lunches with the practices that we already had relationships with, just to say, you know, we thank you for this relationship, we thank you for using us, here's lunch on us, let's talk about what we can do in the future, what we don't want to do as much anymore. And we also had lunches with prospects. Like, hey, we know that you do surgeries. We like to give you access to our surgery center. Let's see if we can make a deal. That is all part of relationship building. So that's important. And if you know how to do that, if you've ever done that in your line of work, if you've connected your organization with somebody else, you have a transferable skill that is important and imperative in the healthcare administration field. The last task I want to talk about is data analysis. The industry requires data analysis to find efficient and effective ways to help solve existing problems. You must be able to interpret said data that you collect and make it goal-oriented, make it solution-based. If you've ever worked in an organization where you had your clients or your customers fill out comment cards, and then you've done something with that information to make the experience better, that is a piece of data analysis. If you've ever gotten information from a group of people and put it into some sort of Excel sheet and done something with that information, that is data analysis. Data analysis is a really technical skill that is highly sought after in the healthcare administration field, because healthcare organizations want their, I don't want to say customers, want their patients to have the best experience that they can have possible. And sometimes when you're working in the environment, you can't always see what was missed as a patient. So when we are asking those questions, you can bet that those organizations will pay people, this is consulting or a position in their organization, they will pay people to interpret that information and disseminate it to them so that they can figure out how to make it work for their best interest. Okay, so we've talked about what experience you have. We talked about transferable skills, how you can use what you are already doing to get yourself into the healthcare administration field. Let's talk about education. It is obvious that in the healthcare administration field, the higher of education that you have, the more opportunities will be presented to you. That is a given. However, a degree is not required to get into the healthcare administration field. I know this because I started my journey without a degree. So if you do not have the time or the money to invest in getting a 4-year bachelor's degree or a master's degree, don't fret. There are other options for you. I would highly suggest getting a certificate. Now, let me preface that by saying you don't have to have a certificate. When I started in the healthcare administration field, I had nothing. I just knew I wanted to get in there. But it would have been easier for me. No, that's not true. I would have had more opportunities had I had a certificate. So let's talk about certificates. You can literally go into Google and type in healthcare administration or healthcare management certificates, and it will give you tons of options because they are there. You want to make sure that the organization, the educational organization that you choose is accredited, and it would be better if they were well known. Some colleges like Cornell College has certificates, Harvard has certificate, Yale has certificates. Like, you can get certificates from some big names. So when you're looking at those lists, you want to compare and contrast the class descriptions. You want to look at what this description is offering you and make sure that is in the arena that you want to work in. They have certificates for quality improvement, which is going to be all about like data interpretation. If you don't really want to do that, you might want to get into like public policy, which will teach you about legislation. If you don't want to do that, you might want to get into healthcare business office, which will tell you all about the business side of running a healthcare organization or being in management. So really compare, contrast, and really dig into that description. And as soon as you click on that class and give those folks your email, they're going to be emailing you back to back to back to back. Take advantage of that. Take advantage of that. Schedule yourself a meeting. Ask those people those questions. Ask them if they have any discounts, any scholarships. Those people literally want to educate you because that is how they get their revenue. So they're going to work with you the best way that they can. These certificates are typically less than 9 months long. They typically cost under $3,000, and they result in a significant salary change. I promise you, from going from a call center to a healthcare organization, big change, which is, what we need these days. So here are some things to look for in the description that I find important to be able to snag a job that has some flexibility, not just quality improvement, but maybe you do a couple things in your job. They'll work better for you in the long run because you will present yourself more opportunities because you're more well versed. So this is medical terminology, record and file management, intro to diagnostic and procedure coding. That is huge. Anything with coding, you really want to get in there. A management course, an ethics course, and a data analysis and quality assurance course. Those are my top picks. So we've talked about experience. We've talked about transferable skills. We've talked about education. Let's talk about amping up that resume. Once you've completed all these steps and done all that you can do and you're ready to get yourself out there, let's talk about the resume. We want to get away from the common words in your resume. We want to get away from the commonality in your resume, and we want to get you into the recruiter's pockets. So let's start out with the basics. You want to put your contact information. Just put your city and state. Do not put your address. Do not put your zip code. Don't give these people a chance to profile you if they don't need to. You want to have a professional summary. This is short and sweet and tells of your years of experience. It doesn't have to be years in a specific job. Say I worked 4 different jobs over the course of 8 years, all doing the same thing. I'm not going to say I worked 4 different jobs. I'm going to say I have 8 years experience in XYZ. So they want to talk about your years of experience, what you did, what you brought to the table, and make it impactful and insightful. The next thing you want to put on there are your skills. That's where you insert those transferable skills that we talked about. Customer billing and follow-up, quality assurance and control, staff project management, relationship building, data analysis. Those are those big words that healthcare management people are going to be like, oh, she knows what she's talking about. Let's get her in for an interview. Let's see what she's like. You can also insert any other skills that you may have picked up that were maybe relevant to your specific job. As we know, this is kind of just a general how to get started in a healthcare administration field. So you will know best based off of your skills of your job. Community involvement. You want to talk about your community involvement or your volunteer work or how you go above and beyond outside of your 9 to 5. Like what do you do? How do you help? How are you a good citizen? If you don't have anything to say, I suggest that you start volunteering. You want to talk about your work history. You want each position to tell a narrative of what you did, why you did it, and what the results were. Okay, so really think about that when you're putting together your work history. Stay away from the common, the regular stuff. Really think about that. What, why, and what the results were. So I'm going to give you a list of buzzwords that you should use instead of using these old common words that recruiters see so much. It literally is like their eyes are glazed over and they don't care because it's not catching their attention. So some of the words that you have been using in the past that you want to get rid of are words like self-starter. Instead, use enthusiastic, zealous, motivated, or disciplined. If you use a word like go-getter, try using ambitious or industrious. There is a word that you may use called detail-oriented. Boo, boring. You want to go with analytic, attentive, comprehensive. You may want to say you're a team player. How about go with collaborative, supportive, or reliable? You want to say you are proficient. Go ahead and use a word like accomplished, adept, or experienced. If you want to say you are results-driven, you could say that you are committed, efficient, and intentional. If you want to say you're a strategic thinker, you could say you are critical, flexible, focused, perceptive, and thoughtful. So go ahead and throw those little salt and pepper, hot sauce on your resume, and I bet you that'll get you some more attraction. The next thing you want to put on your resume is your education. You want to put your school name, your graduation year, or expected to graduate, and blah, blah, blah. You want to list out some specific and relevant courses and course descriptions. So if you're putting just a certificate down there, go ahead and put some of those things that I listed off earlier, like what you were looking for, what your classes were about. Go ahead and add those there so people can know, like, hey, she is actually educated in medical coding and billing. She took a course on it. That's going to grab attention. And that is pretty much the the main juice of amping up your resume, of course, it is different person to person. This is very generally speaking. Now, if you want me to look at your resume specifically and amp it up how I would do my own and get you into healthcare administration field, go ahead and DM me. Let me stop playing, y'all. I'm sorry, I play too much. But seriously, if you want me to look at yours and help you out, I can help you. My best friend literally moved up here with me. She came from working in a call center, and she got into Conduit, which is like our state's Medicaid and Medicare. She had a huge salary increase, the most she's ever made, and she was in there doing what it do, being a healthcare administrator. So let's talk about what you can expect on a day-to-day basis being a healthcare administrator. Like, generally speaking, right? There are gazillions of different jobs in the healthcare administration field. There's a lot. So, like, generally speaking, you would manage an entire facility or a specific area, or like a group of physicians. You can expect some type of management, some type of delegation roles. You will provide strategic visions. You will do some planning and engagement. You will diagnose gaps in your healthcare organization and try to fill those gaps. You will mitigate risk. You will build relationship with other healthcare agencies, clients, and insurance companies. Let's talk about a typical day in the life of my first healthcare administration job. This is the very first job I ever did in healthcare administration. I had no experience in healthcare administration specifically. I had no education. I had nothing but the clothes on my back. But it was a great job, and I actually recommend this job to anyone who wants to get involved, because it was a wonderful introduction to the healthcare field. I was a medical biller for a chiropractic organization. Chiropractic billing is in my opinion, easiest coding and billing that you can get into, because chiropractors typically do the same thing every day. There's not a lot of different codes. There's not a lot of different codes and procedures in chiropractic care. So what my day looked like, I would come in I'm sorry, I really have the hiccups. I would come in the morning. I would have a stack of super bills from every single patient that they saw the next day. I would put them in alphabetical order, and then I would enter them into the charts of the patient. So we were kind of like a day behind. So I would go through in the morning. I would enter every single super bill, whatever the code was, whatever service they got, I would enter them in. If they had any modifiers, I would click the modifiers, and I would do that. That would take me about an hour and a half. And then I would go through, run a report, and see how much money we made for the day. There was also another report that I was doing at the same time where I was entering in the money by hand that we made according to the super bill. And then at the end of me putting in all the charges, I would compare and contrast, and they should be the same. So sometimes they weren't the same, and I have to go through every single one of those papers one by one by one. See what the problem is, because it has to equal out. And sometimes, as I started getting in the groove there, I kind of knew, like, this isn't a code I see often. This is probably where I messed up. Or there was a new patient. They probably got, the new patient adjustment versus a regular adjustment. That's probably where I messed up. So as I started working there, I was able to see I was able to find the mistakes quickly, or I wasn't making any mistakes. So after I did that, I would scan all of the super bills into our system. They would get filed for the day, and then I would shred the hard copies. So that was pretty much like the bulk of my morning. Sorry, I got a phone call. But can you see me? Okay, yeah, that was typically the bulk of my morning. After I did that, and even sometimes in between, I would get phone calls. I would answer phones, schedule patients at the same time. I would call anyone who I needed to call. But my next hard task after that was doing insurance verification. If we had any new patients coming in that day, I would call, verify their insurance, make sure that they were able to receive services or figure out how much their copay was, or if they needed copay, if they met their deductible, I needed to know how everybody was going to pay so that we could have our revenue. After I did insurance verification, that's when I started billing. So we would get our RA back from whoever we sent out billing to, and I would enter the charges. So y'all, my video literally stopped recording. After I did that, I put in billing. So we would get letters from insurance company. We'd get checks or electronic admissions, whatever the case may be. I printed them off, had them in my hand, and was entering charges for every patient based off of the piece of paper. So paper was this thick, had to go through each paper. Papers were separated by month. I had to make sure everything was balanced perfectly, things of that nature. By the time that the receptionist had to go on lunch, I was the one covering. So then I would go out to the front and do front desk duties. Now, typically I could still do my billing while doing the front desk, but sometimes the front desk was so busy I could only focus on the front desk. So it just depended on the day. So that was really good experience. I was able to, kind of get a full idea of what the clinic was running like. Now, as I started getting really good, ripping through the billing, ripping through my front desk duties, ripping through the super bills, I actually got to be a chiropractic assistant. Kind of. I didn't have to get a certification. I was trained on the job. I got to take patients back. I got to ask them, where was their issue at? Where were they feeling pain? On a scale from 1 to 10, did it feel tingly? Did it feel itchy? Did it burn? What kind of sensation did you have? I also got to perform some stimulations, like heat stimulation or electronic stimulation, ice stimulations. I got to do all kinds of stuff. So really, if you can get into a chiropractic office for your first healthcare organization job, chef's kiss. It gives you a really sweet introduction into the healthcare field. My chiropractor was a dream. My office manager was a dream. My coworkers were a dream. It was really nice. It was really sweet. The healthcare field can get vicious. The higher you go, the more you want to work with hospitals and things like that. It gets vicious. So having a nice, sweet introduction before you get sent to the sharks is amazing. So I want to end the video here, and thank you guys for watching. If you want to connect with me, if you want me to look at your resume, if you want me to provide you with any services, the best way to reach out to me would be on Instagram. DM me. I check my requests all the time. I'm willing to help. Follow me on TikTok. I post a lot of gems and nuggets there. Sometimes I be dancing, doing my little thing. It's fun. Please like and subscribe to this video. Thank you so much for watching, and I hope to see you in my next video. And also, if you want to see what a day in the life of a healthcare administration looks like, watch my content. That is literally what I do. Okay, I got to go to cheer practice, y'all. I'm running late. Bye-bye.